Hey guys, this is Dr. Brian Wolfe with Wolfe Physical Therapy. This is my friend Kyle. He's had some neck pain and we're going to do some dry needling today. So I wanted to kind of show what we do for neck pain and particularly for Kyle's type of neck pain. So Kyle's told me that he's got pain when he looks down and when he looks to the left and down, particularly back in the neck, consistent with left scap type pain. Has had history of a disc bulge in the past. But from this standpoint, we're looking more in terms of the neurological response that he's getting after bowling. So he was bowling, and that's what kind of brought it back on. So I'm going to show you how we would approach this from a dry needling standpoint. There'd be other exercises, joint mobilizations we do as well with manual techniques and different exercises. But he says the feeling that he's had is he's trying to stretch it a lot, and it's the pain still kind of sticking around. So we're going to try using dry needling to release and actually create what's called a return to homeostasis with dry needling. So you create a small lesion, and then this heals back and restores homeostasis and creates a neurogenic and systemic effect that can help decrease pain. So we're going to try it today and see the response that we get. So right now Kyle says he feels pain looking down and to the left, and what we'll do is we'll dry needle him and see how he feels afterwards. Okay, so now as you can see I have Kyle lying down on his stomach, and so what we're going to do is we're going to dry needle along his spine on both sides, and then we're going to specifically pick the left scap, which is back up in here. And what we're trying to do is, since we're not trying to hit the left scap exactly, that's very difficult, what we're going to try and do is be in the general vicinity, because that's what's going to give us our homeostatic response. So what I have here is a 1-inch needle. You can see it. It's very, very tiny. You may not even, there you go, you can see it a little bit on the camera. They bend, they're very small. So the majority of these techniques are very easy and they're not painful. So sometimes when you hit a systemic spot, it can be a little painful, but overall, the actually is not really painful at all. So I'm going to start here. I'm going to start around C3, work my way down about T3, 4-ish, and we're just going to alternate each side. And there's a needle in there. We're going to pull this out here. And all I'm going to do is when I work with patients on a more repetitive basis, I stick needles throughout the spine, but I like going one in, one out, just in case someone gets a response they don't love. Then we don't have to take out multiple needles at a time. And that's just personal preference. There's people who do this all differently in different ways. And there's another needle there. And now what I'm doing is just moving down to the next level. And this actually penetrates the skin and muscle down towards the bone. And Kyle, how you doing, bud?
All right.
Good. Like I said, if I see patients squirming around and they're not liking this, we abandon this treatment. But Kyle's gotten great response from it in the past, so this is something he's found giving him a ton of relief. And as you can see, the needle's so small. Sometimes a little droplet of blood will happen, but in this case, zero blood. It's people say, well, is there going to be any blood involved? And I say, well, if the needle's so small, the muscles around actually close up around it. So it's you don't even see blood because it's such a tiny needle. Incredibly safe technique, really effective. And again, all we're trying to do is get a response to restore the body back to homeostasis. Try and get that stimulus and neurological response. There's not really many ways we can do that other than with manual techniques and techniques like this. When here I'm feeling a little resistance, This is the side that Kyle said he had some pain on. We don't push through resistance, but we just push to it. How's that feel, Kyle?
It's fine.
Good. So sometimes you'll see some twitching. Sometimes people will have a little bit of pain. So here I'm going to add a little bit of pistoning, a little more of an aggressive technique. I wouldn't do this with someone on the first time, but with someone like Kyle who I've done this with before, I know I can try it. I'm not doing any real deep pistoning. And that's up there. I'm just going to switch the needles. Get him a new needle. All right, so now we're going to move a little bit more into the upper thoracic spine. And again, we're just moving down. And the reason we're not being global, I mean, if we look at the neurological supply from the left scap, we're not really getting a lot of contribution from the thoracic spine, but at the same time, there's neurological levels where these trunks come from. And so everything responds back from the spine, or everything originates back from the spine. And then I did feel some resistance. So sometimes what you can get is with this neurological tension, we're really trying to be specific with making sure we're not doing any harm with the needle, but at the same time we're trying to be in the region for where someone has a has a restriction, and the neurology here is such that all we have to do is be close to the nerves, and we know where the region of the pain is, so that's where we stay. And then we also go towards the neck, because that's the neck, the back, and the lumbar spine innervate different muscles in different trunks. And so with that, we want to stimulate those nerves as well. So that's why we go along the spine. So it's nice to take our time going slowly along the cervical and upper thoracic spine here as we do this. And then we'll actually go for the muscle where he has pain. People ask me, well, now are we safe with our techniques? And I say, well, what we're doing here is this needle just stopped at the bone, and the bone is protecting our body. So I know where I am. I can't go too far. So the thoracic spine, also while we're getting this neurological response, we're going to have a great response, and it's not going to be something that's painful. All right, so what I'm going to have to do is we're going to go for the left scap now in the region here. So we just need to be in the region of where the left scap actually originates. And this muscle helps to turn the head. And so specifically why Kyle has pain looking down into the left is because neurologically he's actually stretching that muscle, and that's what's causing that pain, so that muscle's irritated. So what we do is I have a patient, and right now I have a hold of Kyle's scapula. I'm going to have him raise his arm up. And so what we're looking for is right along the ridge of the scapula. Good, and relax. And this is right here. It's the top superior corner, superior medial corner of the scapula. So I'm going to have Kyle, I'm going to bring his arm down. So I'm right here, and what I'm going to do is I'm going to go towards the shoulder. Set the needle here.
It's all right.
And so I would expect a little bit of pain, minimal amount, but it's not going to be forced in, and all we're doing is going right to that area where he has a little bit of pain.
Yeah, barely felt it. Barely even felt that.
Beautiful. And so he barely even feels it, even in the spot where he does have pain. And that's it. For the purpose of the video, there's other techniques, there's other spots we can go. The spots are endless. We could go into his scapula here. We go into some of the parts of the neck and the trap. But I want to see how he responds specifically to that particular aspect of pain. So we'll see how he feels after when he gets up. All right, now we've concluded the dry needling session. And what we're going to do is we're going to look at what the differences are and how Kyle feels. He's already told me that it feels quite a bit better. It's not completely gone, which I would be, listen, that's a home run if it's completely gone. But let's take a look at his motion. So how's that feel?
Feels pretty good.
Good, good. Good. And then looking to the right too. He's had a little bit of pain there. Good. The rotation looks good. So his motion looks great too. So we would try some other stuff like soft tissue massage or joint manipulation to try and do some more joint stimulation, try and decrease any type of nerve activity and pain that he's getting, and then try and do exercise to reinforce that. So then send him home with that and have him continue doing that on his own. All right. If you have any questions, you can reach out, email us, or call us. My email address is bwolfe@wolfephysicaltherapy.com. And if you have any questions, you can reach out. Thanks.